Hello, everyone, and welcome to the HealthyXSundays podcast, where we bring you the most critical and actionable content in the nutrition and fitness space. Dave from Mind Muscle Pro and I, Kunal Jain, also known as Veg Diet Coach, are your hosts. Today, we are thrilled to have with us Dr. Anish Musa, a highly respected functional medicine expert, founder of Whiteone, and co founder of the Indian Association of Functional Medicine. With his extensive background in healthcare and his commitment to transforming patient outcomes through a holistic approach, Dr. Musa is on a mission to make functional medicine the future of healthcare. In this episode, we'll dive into what functional medicine truly is, how it differs from conventional approaches, and how it can be a game changer in preventing and managing chronic illnesses. So, without further ado, let's get started. Welcome, Dr. Musa, to our podcast, and thanks for making time for us.
Yes, thank you very much, and I appreciate your effort in a field of nutrition and functional medicine. And it's great pleasure to be here, Yakma.
Thank you. Can you explain what functional medicine is and how it differs from conventional medicine?
So when I talk about functional medicine, I will not say functional medicine is alternate science. I say the functional medicine is a foundation science. Now, if you look at all the medicine, like Ayurvedic medicine, homeopathic medicine, even allopathic medicine, they actually deal with the symptoms or they deal with the medicine. And that's a one part of functional medicine, I can say, but we are missing a foundation. Now, if you look at all the medicine, what is a foundation of healing? So I will say we should focus our effort in creating a healing environment for the patient. And that's the beauty of functional medicine, where we work on a foundation. Like foundation is, we can say, a diet, lifestyle, and the missing part in all the medicine is, I say, nutrition. So functional medicine is actually a combination of, you can say, nutrition, medicines, and Ayurvedic. So it's an integrative approach while we deal with the chronic health conditions in India and around the globe. So I say functional medicine is actually not an alternate science. It's basically foundation science where we look at patient's condition and we treat a root cause of that condition and we make a personalized approach for that particular patient. And that make a huge difference in patient's outcome. And that's what the functional medicine is stand for.
Right. So, one of the misconceptions related to functional medicine, or at least people around me, and I also had at some point, was that functional medicine is more towards the supplement side rather than diet and other approaches. It's mostly supplements upon supplements is the misconception. So, would you like to clear this up?
So as I mentioned, you functional medicine is not just a prescribing a supplement. So when I take, let's say, give you a simple example of how I treat the patient from functional medicine approach. So when patients comes to me, I look at complete holistic approach to collect all the information of the patient. I will look at their diet, I will look at their supplements, I will look at their nutritional status, and then also I look at the root cause. I want to find out the root cause of that particular patient. And then nutrition is a one aspect to treat the patient. As I mentioned you, the functional medicine is a foundational science where nutrition is a one part, not a wholesome part. And that's the misconception people are carrying, that you go to some doctor and they prescribe a bunch of supplements to your patients, and that's a misconception actually in a functional medicine. So we like to treat the patient and diet. So food is not an supplements for that patient, and food is not a replacement of a nutrition. So we have to take a nutrition primarily from the diet itself. Why we need supplements? The question should be there. Why we need supplements? If our diet is sufficient in all the nutritions like vitamin D, B12, magnesium, all these things, why we need supplements? So in our approach, we deal with the nutrition and supplements, but that's the initial part. When the patient having too much deficiency of vitamin D, yes, we would like to correct that deficiency using a supplements, but that's a one point. And then our goal is how we can shift the patient to a nutrition diet where they can get vitamin D. Let's say what is the source of vitamin D? We should teach the patient to go in the sunlight and get an enough vitamin D2 in their diet. If there was sufficient vitamin D2 and there was sunlight exposure, they can readily convert their vitamin D2 to active vitamin D3. So it's not just about the supplements. Sometimes changing a lifestyle, changing a diet, they make a huge difference in patient life. Let's say another example is vitamin B. So do you know that we all know that vitamin B12 is not available in a vegetarian source. So if we consider that data, and if we look at the vegan patients, their vitamin B12 should be zero theoretically. But you will not find out any patient on the earth that vitamin B12 level is zero. So my question is, if the vegetarian diet doesn't have vitamin B12, then how this vegan patient is getting vitamin B12? Now, if you look at the science, then you can find out that gut microbiome produces vitamins. So if you correct your gut microbiome, right, you will get in this nutrition. So rather than putting a patient on long-term B12 or a B complex or other nutrient, why don't we focus on something on patient lifestyle? Why we create some kind of probiotic in their food, like already in our Ayurvedic medicines and our old ancient wisdom, we already eating the achar in our diet, pickles and achars. And so many fermented food was there in our diet, if you look at our ancient diet. But because of modern lifestyle, we had omit that. And now our diet is most often a carbohydrates and sugar and artificial substance. So it's not just really making it doesn't make a sense to put a patient on a rest of their life on supplements. Supplements are useful, nutrition are useful, and we have to correct that. But that's a therapeutic approach. And then when we put the patient on a maintenance, our primary focus is to enhance their food and teach their food how they can make an fermented food, how they can make their healthy gut microbiome, and that make a huge difference in their metabolic processes. So yes, you are right. There's a misconception because many doctors or practitioners who actually prescribe supplements don't look at the whole sum of functional medicine foundations, and they just prescribe the nutrition supplements. But is functional medicine not just in supplements? We want to find out the root cause of that particular patients, and whatever the nutrition they are deficient, we have to correct that. That's important. But that's not the only thing we are doing in functional medicine.
Right. So you spoke about metabolic illnesses in the start, about the world, and how Indians are also facing a lot of metabolic illnesses. So like diabetes and fatty liver are so common, PCOS are so common. So what do you think is the root of this, as from a functional medicine perspective, and what solutions are there?
Okay, I will give you a story of my recent patient who came to a conventional radiologist and they had checked their ultrasound and they had find out grade 1 fatty liver. And then they write down a grade 1 fatty liver in their report, and then doctor asked the patient, patient asked the doctor that what is a fatty liver? Oh, it's a normal. So should we consider this grade 1 fatty liver as a normal?
Not at all.
And not at all, right? And then patient, and if you check HbA1c, the HbA1c is 5.8, and then again they ask doctor, my HbA1c 5.8 is normal? Oh, it is normal. You don't have diabetes. So we are missing a one important part of healthcare system as a dysfunction. So our healthcare is focused on a disease. We are not really focusing on a dysfunction. And you know very well the dysfunction appears first, and then you start developing disease. Now you very well there you point out the metabolic syndrome. I will give some statistic for diabetes and hypertension and metabolic conditions. Now, if you look at the statistic, then you will surprise there 11% of Indian population right now having a diabetes. 11%. 15% of Indian population, they have a pre-diabetes. Now, if you combine diabetes and pre-diabetes, because pre-diabetes, they are on a way to develop a diabetes. So we can consider the entire health and disease as a continuum. So we can understand that 15% of Indian patients right now, they have a pre-diabetes. In other sense, they are on the way to develop a diabetes, and 11% already developed the diabetes.
And many
Now, if
don't
you
even test.
and nobody's looking at this data. And now, if you look at the hypertension, do you know what is the number? You're surprised by looking at the number. WHO says in 2014, I don't have a recent data. They said that 24% of adult population they have a hypertension, and 21% of female they have hypertension. Now, just imagine that 11%, 15%, and 24%, almost 50% of adult population right now they have a metabolism. It's a huge number. So that's a very stressful data for us, right? So whatever we are doing last 20 years, we are treating a diabetes in conventional medicine, all the medicine. I'm not saying the conventional medicine, allopathic medicine, or Ayurvedic medicine, Ayurvedic medicine, but whatever the medicine we are doing this one, it is not solving the problem. So if our medicine is effective, then we should not have a problem. And if you look at the data, this all diseases are rising, the chronic conditions are rising. This means we are missing something. And I would like to ask you all who are here, what we are missing while we look at the conditions, while we look at the chronic conditions. And that's what we are missing is the root cause. What is the root cause? Our question should be focusing from not just focusing on our symptoms or treating a diabetes. Our goal is to how we can prevent this condition. What is the root cause of all these conditions? And that's how the functional medicine deal with. So yes, you are right. The metabolic conditions are very in a rise. And if you look at the connection of metabolic syndrome or metabolic conditions to other disease, and you can find out, yes, there is a connection with an low testosterone. Yes. Is there any connection with thyroid dysfunction? Yes, there is a connection. Is there any connection of diabetes with gut function? Yes, there is a connection. So body is not just working on isolation. So in conventional medicine, the primary difference is we look at the disease in isolation. Like we look at the liver disease, we look at the cardiac disease, we look at the ophthalmic disease, we look at the brain disease. And that approach is very important for acute conditions. But if we do that approach for treating a chronic condition, then we are missing something. And that missing something is actually whole functional medicine. So functional medicine actually connects the dot between all these functions and dysfunctions. And that's the beauty of functional medicine, where we actually find out and treat the conditions.
Right, doctor. So, what is your take on the different emerging diets? Like, diets are getting very popular these days to treat metabolic illnesses. For example, low carb diet, and then even carnivore diet is picking up acceptance in India. So, do you think, like you said earlier, that diet is a very small part of functional medicine? We have to look at the root cause. So, what do you think the emergence of all these diets, are these good approaches to treat metabolic syndrome, or are they better approaches we should look at?
Yes, that's a very good questions, and I will say in different way. We will not see. I don't see the diet. I actually see as a food. So our first question should be: should whatever the condition we are treating, let's say metabolic condition, we take an example. So our first question is: what is the nutritional status of that particular diet or food? That we want to find it out. Now, if you look at the overall process or root cause of metabolic condition, what is the root cause of metabolic conditions? Why the patients cannot digest sugar? So now, if you look at the diabetes, now I would like to define the diabetes in simple words. Now, what is diabetes? Diabetes is just simple carbohydrate intolerance. So patient cannot tolerate sugar and carbohydrates. That's the simple meaning of metabolic conditions or carbohydrate. So why the patient have a carbohydrate intolerance or sugar intolerance? Why their blood sugar is rise? Maybe there is something we called in a conventional medicine, all the medicine, it's a insulin resistance. And then again we ask the question, why the insulin resistance is there? So if you look at the whole process of this metabolic conditions, then actually it's a sugar intolerance. It's a carbohydrate intolerance. Patient cannot convert their sugar into energy. And now if you look at the body, then I will surprise you with the data that our body doesn't have any sugar storage. We can't store sugar and carbohydrate in our body. We just have a very minor source of glycogen. Otherwise, we cannot store. So we only have an option to convert this sugar into energy. We don't have any other options. The simple meaning of diabetes is the patient cannot convert the sugar into energy.
Right.
And that's why they increase the blood sugar over there. So now our goal is to how we can optimize the diet and sugar. So in a as you said, low carbohydrate diet is a very good option to start in a diabetic patient. But that is not the only thing you think and you prescribe to a patient. But usually in diabetic and metabolic condition, we prefer that reduce the carbohydrate. And very much misconception in conventional world is all fat is bad. but that is completely wrong. So if you look at our body is almost 15 to 20% is a fat. So we need to change the conception of a fat. And in many patients of diabetes, we have seen they can digest fat very easily compared to the sugar. So it's really depending upon patient's choice. They can use vegetarian diet and they can low carb diet, even carnivorous diet. See, we cannot see one diet fit to everyone. Let's say I give you a simple example of carnivorous diet. They have a very high fat diet, saturated fat diet. But let's say if you have a gut microbiome that is unhealthy and they have a gram negative growth, and if you prescribe this carnivorous diet, they are more inflammatory for them. So it's really, I would like to convey the message that one diet is not fit for entire population. We have to customize according to the patient's stage. Even two patients of diabetes, we might start with some kind of dietary changes and we change the diet. So it's really depend upon patient to patient how we can prescribe the diet. But that is a good start. You have said the low carbohydrate diet is a good start in a patient, and that could be a starting point.
Absolutely. And you spoke about gut health. So, how does gut health play a role in the development of these chronic diseases? Can you explain the gut disease connection with metabolic diseases?
Yeah, gut is very important organ and it was missed completely in a conventional medicine. But if you look at the Ayurvedic science, then they say that disease start in the gut, and if you want to heal, then you have to heal the gut. So why they said 3,000 years back that gut is very important organ, and why it is said so? So now if you look at the gut function, then what we do? 3 times we put a food in our gastrointestinal tract, and then our body work on that substance, and then we want to digest and we want to make some nutrient over there, and then we want to absorb that. Now, one important mistake we are doing while we look at the gastrointestinal tract, or collectively it's a gut. Now, we think that when we eat the food is going in the body, but that is not correct, because our gut is actually hollow cavity. It starts from the mouth and it's ended in anus. It's actually a hollow pipe, or we can say hollow cavity. So when we put the food in the mouth, the food is not in the body. Food is still in the external environment, where there are bacteria who are going to interact with us. Our enzymes going to interact with that food, and depending upon that enzymes and the bacterial composition, we're going to reform the food, and then this food or the substance they're going to absorb from the intestine. And that's the beauty of learning a functional medicine, learning a physiology of a system. And then you came to know that our immune system, our 80% of immune system is around our gastrointestinal tract, and that is called gut associated lymphoid tissues. So now you look at the immune system is around the gut. You are putting up foods over there. There are microbes over there. So gut is playing very important role in maintaining a nutrition, controlling an inflammatory status, and that's the beauty of gut. And in many patients of diabetes, we have seen there were candida overgrowth, fungal overgrowth, and that's a correlation you can see from the metabolic conditions to your gut functions. So that's a connection you can find out in a metabolic conditions.
Right. So there's this new emerging trend of new sorts of things, nutrigenomics, where they are talking about genetic based diets and gut mapping and all that. That trend is on the horizon. So, what is your thoughts on this? Is this advanced stuff, or is this not relevant for the common?
I will Yeah, I will make it simplified for everybody so you can understand genomics and the environment. So if you look at genetics, so in conventional world, we know that every disease arises from genes. We have also misconception, like let's say we have a patient who developed diabetes. We ask the family history, and this says that the father is having a diabetes. So we come to a conclusion that you develop a diabetes because you have genes for diabetes, and that is not completely true. See, genes are important, right? Genes play a role. But this is a chronic condition. Patients are having genes since birth, but they are developing diabetes at the age of 40 or 50. So if genes are the only player, they will start developing disease at birth. And there are so many diseases in genetics, metabolic defect, and they start developing at their birth. But they start developing diabetes, hypertension, and thyroid later on their life. This means genes play a role, but they are not enough to express the disease. And we need to stimulate the genetics, and that's the environment that's playing a role. And when we consider this environment, we consider them as a epigenetics. One of the epigenetics is your nutrition. Let's give a simple example, vitamin D. So do we have a receptor on DNA or genes for vitamin D? Yes, we have. Do we have a receptor for folic acid on our genetics? Yes, we have. So this nutrition particularly can turn on or turn off the genetics. I will give you another example, methylation. So in a genetics, very known process is called methylation. So if you have proper methylation in your nucleus or DNA, you can control the expression of your genetics, right? So what I mean to say is, if you look at the one aspect, I'm not saying that that's only aspects. The one aspect is you can look at your nutrition. When you talk about nutrition, we talk about vitamins and nutrition and phytonutrient. So this nutrition can turn on and turn off the genetics.
Right.
Now your makeup of genetics could be different. And that's way you can control the expression of genetics, and you can prevent or you can express the disease. Now, if you are expressing the disease, means your genes are expressed. And if you want to reverse your disease, then you have to work on a genetics and you can reduce the expression. So the beauty of functional medicine science and says that our genes are there, they are important, but they are not our final destiny. You can turn off your genetics. And you can see you turn off the expression of your genetics by doing a nutrition and increasing nutrition. So that's all about nutrigenomic science.
Right. So, one of the biggest factors which is common these days is stress. Stress is like a huge factor. Everybody is stressed. So, how much of a role does stress play in all these metabolic illnesses, and what are some things we can do about that?
So when I talk about the stress, and Kunal can resonance with me, I will not talk about stress. I will talk about the distress. We are using a wrong term. See, stress is important for life, right? We have to stress our body. We have to stress our mind, right? So we can grow ourselves. Let's say you go in a gym. What you are doing? You are taking a 10 kg, then you 15 kg. So what you are doing? You are actually putting a stress on your muscles. So stress is important. So we'll not say that stress. It's actually a distress. When your body and your mind and spirit cannot convert this stress into a eustress or a good healthy outcome, you're actually converting this stress into a distress. And distress is a problem. So we should change our terminology. We should not use a stress. We should use a distress. First thing. And distress, when you put in constant distress on your subconscious mind, actually you hamper your limbic system. And the whole science of limbic system, HPA axis, and how it's going to affect your hormones. So it's not just a stress that going to affect your body, it's a distress that actually malform your limbic system and your hypothalamus pituitary axis. And then you can have a two response. One is your sympathetic response, and other response you can have your cortisol response. And now there's a whole science, or all science and connecting dot, that when you have a chronic stress, and I will not talk about the acute stress. Acute stress is a good thing. If you can convert that stress into a eustress, right? So we talk about the chronic stress. And chronic stress can lead to adrenal function, even high cortisol level is connected to your metabolic syndrome. And by the way, what is cortisol? Cortisol is the body's natural steroids. So let's say if somebody is having a constant distress and they're constantly stimulating their adrenal glands, and adrenal gland is constantly increasing the cortisol level, the small rise of cortisol level over a long period of time, they actually invite the metabolic conditions. So this is how it is connected with your metabolic syndrome. So a huge impact of a stress or chronic stress. And nowadays you can see we are having too much brain stimulation from a social media, from news, and from all around. So our brain cannot process that stimulation, and nobody knows how to calm down the nervous system because we are in a world where we have constant stimulation. Now look at our Earth. We don't have a concept of day and night. Even night we have lights. So if you look at if you take a flight and if you look at the city at the night from this 30,000 foot height, you will see there is no night. There is no night. So all these small impacts are there which constantly stimulate our brain and that make our brain distress. And that has a huge effect on our metabolic conditions. Yes, you are right, Dave. That is the one part that people can develop a metabolic syndrome. But I would like to give you an idea about, when you look at the chronic condition, don't just find out the one cause. Now we are doing a mistake because in conventional medicine, our mind is grown to find out the one cause. That's how we had studied a conventional medicine in this regards. That if you're a patient, then we have to find out the one cause because we had taught in same sense that if you find out two cause, then you're probably wrong. Because if at that time we have acute conditions, patients come with a specific symptom like fever or pain or chest pain. So our whole evolution, whole knowledge is based on acute conditions. So in functional medicine, we should understand that we might be a multiple cause. All the contributing factors are there. And that's the reason patients develop chronic conditions.
Right. Expanding on this further, can you talk about environmental toxins like food as an external source we are putting into our body? Similarly, nowadays we are exposed to pesticides, heavy metals, different pollutants, the air we breathe. So, what is the impact of all these pollutants on our health? And are there any good ways to detoxify?
Yes, that's a very interesting question. And I would like to give you some data that from 2021, we had estimated, the survey estimated that we have a rise of more than 12% rise of a cancer in just a span of 3 years. Then I start thinking why we have increased the number of cancer that we are seeing in these days. And then, as I mentioned, there are multiple causes for that. Maybe they have metabolic syndrome. And one of the aspects what I studied is we are exposed to toxins, and that's our body cannot detoxify. That leads to a toxic load. So it's a different thing where we have to learn is when two people are exposed to toxins, one person doesn't have any effect on the toxins because they can detoxify their toxins. On the other side, the one person cannot detoxify. And that leads to a toxic load in the cell, and that's really hampered the cell functions. Now I'll give you another data. In 2019, it's very interesting stuff. 2019, Kerala government has written a letter to a PMO with an urgent notification, and they said clearly in that letter that glyphosate and all the derivative of glyphosate should be stopped or banned immediately. This is in 2019. Why they say so? Because with the agriculture university in Kerala, they had done a lot of studies in the food and the pesticides, and they find out the very high level of this glyphosate on the food.
Right.
And they also said that this glyphosate, when you put it glyphosate for 3 months, you will actually kill all the bugs.
Right.
Right. So we are not just creating a toxins and toxic environment for the human body. We are also damaging our earth microbiome. Right. And that way, whole scene will change. So coming to your question, that there is no doubt on we are exposed to our toxins nowadays because we have modern lifestyle, modern agriculture methods, and we are using so many chemicals. Glyphosate is one of the example. Otherwise, we are dealing with many kind of chemicals, industrial chemicals, plastics, BPA, and we are also dealing with many endocrine disruptor. So that's a huge impact on our body. And if you are exposed to this kind of toxins, your cell cannot work. Now just imagine that, as everybody agree with me, that we have an exposure of a toxins compared to 50 years back, and same time we have a nutritional deficiencies. Now let's just look at the cell. How can cell function? And that's we invite the chronic conditions over there. So yes, you are right that we are exposed to toxins and we have a deficiency of nutrition. Our cell cannot deal with that nutrition or that kind of environment, and they start having expression of some other disease.
And I think even the Wi-Fi signal adds to the problem.
So you can look at the toxin like environmental toxic load. You can see Wi-Fi or 5Gs. But as I mentioned, let's say we have to look at the individual response to a disease or signals, right? So let's say two people are exposed to a signal, they will not develop a disease. One person already they have a toxic load, they have a nutritional deficiency. The Wi-Fi signal can affect that cell in more intense way.
Absolutely. And talking about autoimmune conditions, they are also on a rise globally. So how does functional medicine approach autoimmune conditions? Is there any difference from the conventional approach?
So autoimmune condition actually they was very rare. I was studying my MBBS, I think 25 years back, and where we are very, frankly speaking, we put autoimmune condition on a options. We don't study the autoimmune conditions because we don't have autoimmune condition that we see in our patients, because at that time acute conditions are more often, and we are dealing with an acute condition infections. But nowadays, if you look at the data, in the last 20 years, we have a rise of autoimmune conditions. And then again, I think, why we have a rise of autoimmune conditions, why the immune system is creating antibodies. So if you look at the primary function of immune system, then what is the primary function of immune system? Primary function of immune system is to protect us. But let's say if your immune system is bombarded with all triggers, that trigger, as we are discussing earlier, that can be a chemical, can be a dysfunction of your gut microbiome, can be infection itself, can be something else, right? So immune system is not resilience with the environment, and then immune system is upregulated. So when the immune system upregulate, what will do? It will going to damage your own cells, and that's the basically foundation of our root cause of your autoimmune conditions. Now, the treatment is we have to work in a conventional medicine. What we do, we shut down the immune system by steroids and
Suppose.
methotrexate, immunomodulator drug. So what they do, they actually shut down the immune response. And obviously, when you shut down the immune response, you will not have any kind of symptoms, because for inflammation, we should be having an immune system. So if we have an immune system and we have trigger, and with the immune system and trigger, we create the inflammation, and that's the reason people have a damage to their cells and the body. So one of the conventional medicine approach is to shut down the immune system, where you will have a symptom-free body and life. But my question is, putting a patient on a chronic suppression of immune system is a good idea?
No.
It's a starting point. Yes, obviously, we have to work on immune system. If somebody having a severe rheumatoid arthritis, severe pain, we have to prevent the joint damage. Yes, of course, we have to use that one, but that could be a starting point where we shut down the immune system, and then we ask the question: why the immune system is too much angry? Why the immune system is too much on upregulated? Then we come to know, oh, this is the gut dysfunction and they have a gram-negative overgrowth, and this is a one point they are stimulating their immune system. Oh, there is some kind of toxic load. Oh, there is some kind of deficiency of nutrition. Oh, there is some kind of stress in patient's life. So all these factors are playing a role in an immune system. And what is our goal? Our goal is to calm down the immune system and slowly withdraw to a minimum dose of these immunosuppressants.
Right.
So that is the approach you should learn. So basically, we have to learn the principles of functional medicine, principles of how the immune system works, and then you can find out what the patients need.
Right.
Now, if
So
you
I
look
have
at
a
this, Yeah, please go ahead.
I have a follow-up question. So everybody wants to know whether there are cures to disease like autoimmune, or is it just remission where you control it?
Yeah, that's very important questions. Now, if you look at the many disease, like I can say in different way. Now, forget about the remission, forget about the reversal and all the terminology you are looking at the in a conventional word. Just let's look at here. On one side your health, other side your disease. Now, all the conventional approach is focusing on the disease, focusing on the disease, focusing on the disease. I will give simple other idea. Why we focus on a disease? Instead, we focus on a dysfunction, correct the function, and focus on health. So our goal is not looking at the remission, looking at the reversal. Our goal is to create the health. Whatever the health we can create, we have to create the health. So we have to change the patient's focus from the disease to the health, and that way you can really make the impact. And these terms like a remission or your reversal, they actually misunderstood and misconceptualized. Now let's give you a simple example. What is a cure? Cure means if you have a typhoid, I give you antibiotic, I kill the bugs, and you will get rid of the typhoid, and I label you are cured of typhoid. But that doesn't mean you will not get an infection again. When you get the infection again, you get the typhoid. So in the first place, had I cured the typhoid? No. I had cured the typhoid at that particular point. Same way, if you look at the immune system, let's say in autoimmune conditions, I make immune system resilience, then immune system is not stimulating or not creating antibodies, right? And the immune system calm down, and then you label as a cure. But again, let's say if you have a same kind of stimulus that created the first imbalance of your immune system, again you have that infection or that dysbiosis or that leaky gut or that toxins, what will have? Your immune system again create the antibodies and again damage the cell. So actually it's all misconception of remission, cure, reversal. But again, in my terminology, if you look at functional medicine science, then of course you can create the health, and you can just treat the disease.
Right. So, for the information of all the audience and the future viewers, what are some blood tests you think is like very important? Right, there are so many tests you can do. You can do cortisol, you can do this and that. So, how many tests, or what are the most important tests a
Yeah,
normal person
that's
should do?
that is a very good, interesting question. So I mentioned earlier that we are dealing with the metabolic conditions. 50% of your patients have a metabolic conditions, and 20% of your patients have a thyroid conditions. They have huge impact. And if you look at overall, and if I want to recommend some kind of lab test, then usually my focus would be diagnosing a dysfunction of metabolic conditions and to diagnose the dysfunction of thyroid, right? So you can look at the look at the CBC. Now in conventional office, doctor usually look at the CBC and they only look at the hemoglobin. They only look at the WBC count, and they miss a lot of stuff over there. With the CBC, you can diagnose iron deficiency. With the CBC, you can diagnose the B12 and folate deficiency. Even with the B12, you can diagnose the chronic viral. Even with the CBC, you can diagnose the chronic relapse of the autoimmune conditions, right? Even you can diagnose the parasite over there with just CBC, right? CBC is
Mhm.
very important. So all the counts you can see and you can find out the optimal range. So one important concept in functional medicine is, as I mentioned we look at the dysfunction. Now in conventional lab, they are primarily focused for the disease. So now if you look at the disease reference range, you will miss the entire functions. So instead of I would like to teach you, you should look at the optimal range. And that's a very important concept where you find out the functions and the dysfunctions. Let's make you a simple example of B12. Now, if you look at the B12, then B12 conventional reference range is 211 to 946. Now, let's say if your patient having an 300 of B12, should we consider normal?
No.
Right? So even right or wrong is depend upon the patient. Let's say I have healthy patients whose B12 level is 300 versus a patient who came with a neuropathy or neurodegenerative disorder. I will keep their vitamin B12 to 1000, even more than a normal. Right? So it's really, we have to change the concept of an optimal range and a standard range. So if you want to find out the dysfunction, then you have to look at the optimal range where you can find out. But as you mentioned, that what are the tests you should do commonly? So you have to do a metabolic panel, you have to do a CBC panel, and check your nutritional profile. That's a very important things, because we are seeing a lot of nutritional deficiencies in autoimmune condition, metabolic conditions. So that's you should check it, and of course a thyroid panel. And when you look at the thyroid panel, you should do a free T3 and free T4. If you have already a thyroid condition, make sure you check a T3, free T3 and free T4. So whole functional medicine is look at the physiology, functions of the body. And according to that function, we do a testing over there. So yes, you are right. We should do a basic profile of metabolic and thyroid and nutrition. That we should do it.
Right. Are tests like heavy metals important for a normal person?
Now, the question is very interesting. But if you look at the heavy metal testing, what we are doing in India is serum heavy metal testing.
Right.
You will not find out any chronic toxic load in a serum, because your heavy metal or other toxins will remain for a very short time in a serum. Let's say if you exposure of lead, the lead will stay only for a week or 10 days in the serum. So that test is important for the acute poisoning, not for the
Mm.
chronic poisoning. So I'm not doing any kind of toxic serum toxic panel over there. That will not give you accurate results or accurate interpretation for the heavy metals over there. Another test you can do for heavy metals is hair mineral analysis, but again, that is not the perfect test. The ideal perfect test for the heavy metals is urine challenge testing.
Right.
Unfortunately, we don't have that testing in India, but I assure you that within 5 to 10 years, you will get this kind of testing in India.
Right. Right. So, do you suggest that the testing should be done from a functional medicine facility rather than the common one?
See, if the I will not say functional medicine lab is different than the conventional medicine lab is different. They are using the same instrument. Why should we differentiate them in a different category? Because ultimately they are using the same machines, right, for doing the testing. So even you can go to the conventional lab. They are doing accurate results. They understand the functions of the body, and they do check over there. So you can do with that one. Versus a functional medicine lab, they don't do real testing, and they don't have equipment over there. They don't have a quality control over there. I don't see. I will not differentiate the lab is functional lab and then lab is
No,
conventional.
because we see that in functional labs,
So we can
they
say
they
advanced
have
lab.
more
We can
tests,
so they
RBC,
we can say
magnesium.
yes. We can say that's an advanced lab.
Mhm.
Why the conventional medicine cannot do RBC magnesium? If they can, they can get a kit and they can do it. Why don't they do RBC magnesium? They can do it. But of course, we you as you answer a question that we should do for advanced testing. Yes, we can do advanced testing, but advanced testing should not be done before doing in conventional lab. Otherwise, you are wasting your money and you will not get the right process over there.
Right. Thank you. And one final question from me is regarding the course. Right. I think many of the people, many of the audience here are interested in learning about nutrition. They are always confused. Should I do this book, this course? And I and Kunal, me and Kunal have done your course, and we find it the best course. We have done quite a few courses, and this is the best course in India we have done. So, could you just tell us about your the FMCN course and who is it right for? Who can get into this field and all that?
Yes, thank you very much for bringing this attention of Functional Medicine Foundation course. See, my passion, I will tell you my story and how I created the Functional Medicine Foundation course. Uh, 7 years back, I started learning of functional medicine, I think 8, 9 years back. I find out the IFM, who is teaching a functional medicine to entire globe. And I say, this is the best institute, IFM, who is teaching a functional medicine over there. I had done my all IFM graduation. I done passed their examination. I almost taken 5 to 6 years to complete the entire advanced course and all the modules. One important thing I was missing in IFM is they are teaching a too much theory, and that is not customized to Indian patients. And that's the pain point I'm facing while I had practicing my functional medicine in India. And then I thought we should make a mission to create a functional medicine available to every patient, every household. Why should we keep this functional medicine science to ourselves? So then my passion started to teaching functional medicine to professionals like doctors. We have almost last year we had teach almost more than 300 practitioners. They are coming from nutritional background, they're coming from allopathic background. And here Dr. Vishnu is ophthalmologist, and he's also the part of FNCN course. We have a gynecologist who had done the courses. The coaches, nutritional coaches, they come to the functional medicine course. So we teach this functional medicine foundational science to every professional in the field. And the beauty of this course is we don't teach too much theory. As you see my conversation with you, I will give you practical tools that you apply in your practice. So basically, functional medicine, you can say it's a practical approach to apply functional medicine in a clinical scenario. So that's how we designed this functional medicine foundation course, where we teach there all the function like metabolic function, thyroid dysfunction, hormone replacement. Even for doctors, we have a bioidentical hormone replacement module, so they can learn the progesterone and estrogen. And we have all the component of a food and nutrition we are going to teach them. And that's all functional medicine, what I said, you can learn in a functional medicine clinical nutrition course.
All right.
That's great. So let's open the forum for audience questions. So if anyone wants to go ahead, please, you can. I'll just let everyone unmute their mics. Okay. And in the meantime, there is one question from Dr. I think Dr. Jyotsna, that I have adopted a town. How can I start for diabetes and cancer prevention in that town?
So now you look at the cancer and diabetes, they actually coexist in many conditions. So diabetic or metabolic syndrome is actually part of your cancer. So you can work in a functional medicine way where we want to find out and we have to make a matrix where you can look at the functions and dysfunction, and then you start treating the function and dysfunctions over there. So yes, you can apply the functional medicine science to work on diabetes and also cancer. And functional medicine is a good starting point where you can work in both the conditions. And you can find out so many stimulus, so many dysfunctions we have discussed is similar in a diabetes and also in a cancer.
Yeah, please go ahead, Dr. Jyotsna. Please unmute
Yes,
your mic.
yes. I am asking, can I get some help in Rajasthan? I am working in Rajasthan. I am MBBS doctor, and I am working there for these. Can I get some help? Someone is there in Rajasthan.
Okay,
Uh,
so basically, functional medicine, what we are teaching is a completely online course. So many of our
okay,
students, they
okay.
are from the abroad, from the all over part of the India. So you can join the course, and that way we can help you online, and
Okay.
that we can help you. So I think Rajasthan, I don't know who is practicing functional medicine over there. Definitely, you can join the course and you can learn online. So our whole course is completely online and live lectures, and we are giving you more tools that you can understand functional medicine in great detail.
Okay. Thank you, sir.
And you have to be, Dr. Josna, you have to be pioneer in Rajasthan. I will invite and I will encourage that you become a functional medicine practitioner in Rajasthan.
I am working. I have adopted the town and I am working there, but I couldn't get any point ki how to start with. I am doing some things, cancer screening camps, and for the diabetes, I have registered around 300 patients. And what I knew, some diets and all, I am looking after them and suggesting something. When I joined this conference of yours in December, then I
Hmm.
got a hope that I can do something
Yes,
better
definitely you
for
can
them.
do. Definitely you can
For,
do and
for,
learn the functional medicine in great detail so you can help your patient.
yes, yes. Thank you so much.
Yes, thank you very much, Dr. Josna.
Okay.
There's a question from Garima. How can we test for mold toxicity? Are functional labs the only way?
So for mold toxicity, you can look at patient's timeline, like patient history. Is they are exposed to any kind of symptom? There are symptom questionnaire. You can run the symptom questionnaire to the patient, and you can find out whether your patient having any kind of toxic load. Like simple, you can ask the patient their past history of any sinusitis or allergy issues, or their constant gut dysfunction, or even you can look at the environment they are exposed to any kind of mycotoxins or mold in the past. And if you you can do some kind of urine mycotoxin testing, but this testing are not available right now in India. But you can look at the patient history, and you can even find out the possibility of mold exposure or mold toxins in their history. So I will not just limit myself to only on advanced testing to diagnose the mold toxicity. I will look at the patient history. I will look at the patient's symptom square, medical symptom questionnaire. So we have a something called medical symptom questionnaire score, and with score you can judge that patient might be having a too much toxic load. Yes, you can diagnose. You can confirm the diagnosis with doing an advanced urine mycotoxin testing, but you will not limit yourself on that testing.
Anyone else has a question? Okay, no other questions. Probably we can then wind it up. Dave, any questions from your side?
Nothing as such. It's been a very helpful and insightful session.
Absolutely. It's so nice to see you again, Dr. Musa, explaining all the concepts. Really appreciate your time for coming on our podcast and talking to us and talking to our listeners. So we love to have you back again sometime for another session. But thank you so much, sir.
Yes, thank you very much for inviting Kunal and Dev. And of course, I am passionate to give education. I'm passionate to make patient aware, professional aware about the functional medicine. So I'm here to help you, and we both and we all together spread the awareness of functional medicine in India. Thank you very much for inviting me.
Absolutely. Thank you.
Thank you. Namaste. Bye bye.
Bye bye.